Healthcare workers are supporting Operation Dudula in their current operations in healthcare facilities. They have confirmed that illegal foreigners have multiple files that they use to collect medication that they sell in their countries. So what healthcare facilities or healthcare facility doctors or nurses, they are saying that illegal foreigners, both illegal and legal actually, they come to the clinics, open multiple files, collect medication, and that medication is used in some sort of illegal way, in some sort of illegal business. That medication is sold in their countries. That is so crazy that we still have countries that lack medication, that the healthcare system is incompetent still in 2025. 100 plus years, or yes, 70 plus years after Africa gained independence. And these are the type of struggles we are facing with, we are still struggling with. This is sad. Speaking on Newsroom Africa, healthcare workers have expressed gratitude to organizations that are helping them as their workload has drastically reduced. Check out this clip.
But I would agree that it has alleviated the work that the healthcare workers have had to do, considering since the operations have started. We have seen a limited number of foreign nationals, documented, undocumented, coming into our facilities. It has at least taken off the burden from some healthcare workers, of which it's been a cry for most of the healthcare workers that we are overworked and overburdened, and merely because the government is not acting correctly or rightly by ensuring that these foreign nationals that are here, there's border control, they have documents, and them getting a service, it's within the transcripts of the Constitution. Yeah. So the burden of healthcare workers currently in facilities where there is this Operation Dudula, there's been a less burden for these healthcare workers, and truly most of them do say that with this thing that has been happening, we have seen more efficient services, even South Africans themselves.
Yeah. Listen, I am happy for the nurses and the doctors and the healthcare workers that feel like ever since Operation Dudula, came to play, things have been easier for them. I'm happy. I mean, no one deserves to be understaffed, overworked, underpaid. No one deserves that. We are humans. I mean, it's part of the human rights, and I'm happy for them. But what happened to the oath that they took? The one that says you will serve the people, and even the Constitution does back that up. You took an oath as a healthcare worker that you will serve the people, and the Constitution also backs that up. The underworked notion should be ANC's problem. The government has looted state funds, so much so that there is no money to employ people. Doctors are unemployed. Employed doctors are understaffed and overworked, as I have mentioned. Let's not take the government's problem and blame our African brothers and sisters. It's getting to a point where South Africans will fail to hold the government and the white people that own 90% of the country's wealth accountable. You are starting to make excuses for the ANC for wasting 30 years of democracy. You are treading that line. You are treading that line because I'm hearing it's the illegal foreigners or the African migrants' fault. That time they don't even make up 8% of this country's population. That time, like I've said in my previous segment, that they work useless jobs. The least they need is just some kind of hospitality. They don't need a lot from us. They don't need our kidneys, for goodness sake. I'm hearing people making excuse for the government and blaming our African migrants, our African brothers and sisters, neglecting the white people that are gatekeeping the country's wealth. 90% of the country's wealth is in the white people. And that time the white people make up less than 30% of this population, yet they own 90% of the country's resources and wealth. And no one is saying anything. But you are quick to point fingers. No, you know what? I am happy that our people here in South Africa will be able to access healthcare without being pushed, without being pressured, without being backed in a corner. Now people can easily walk in and out of public healthcare facilities, and they can get top quality care that they've been thriving for, that they've been craving. So, but let's not blame everything on the African migrants. Let's not make an excuse for the white people that own or that still have 90% of the country's resources and health, and the ANC's incompetency 30 years after democracy, and they have nothing to show for it. Let's put the blame where it belongs. What do you think about this segment? Comment to us in the comment section below. Don't forget to like and share the broadcast. Subscribe to our YouTube channel. Hit that notification bell so you don't miss these groundbreaking conversations right here on the African Diaspora News channel.